I don't think there's anything to fear with death from my experience. But if you do fear it, that's very normal. And the fact that you're even willing to say, I'm afraid, are your leaps and bounds of most people. So hospice, in so many words, is about living, is about comfort, and is about trying to support the family who is caring for their loved one at home until they die. If someone's able to make their own choices right now, they need to run through scenarios. How long would you want to be on a breathing tube? Yeah, people get wildly uncomfortable because they don't want to think about that stuff. It's so taboo, we can't even say it. I see relief on their face because everyone's been tiptoeing around the fact that I'm dying. And I want to have real conversations about this. Anyone listening has to be an advocate for their loved one, but also find a healthcare worker that you trust. It's such a good question. I don't think anyone's ever asked me that, and that's such a good question. Obsessing over that last moment that you missed is part of the grieving process. And it's almost easier to do that than to like feel the pain of your loved one being gone. Learning to kind of contemplate your own immortality is the greatest gift you can give yourself. And I literally do that every day. And then what it does for me is help me be clear on how I want to live that day. I just think people would have way more peace around dying if we started doing that.
Well, Julie, it is such a pleasure to have you here for the Movement Living podcast. We've been really looking forward to this conversation to introduce the work that you do to our community. And I just want to start with, for anyone who doesn't know you, who are you and what do you do?
So my name is Julie McFadden. I am a nurse by trade. I've been a nurse for 16 years, and I've been a hospice nurse specifically the past 9. I was an ICU nurse before that. And also now I go by Hospice Nurse Julie online. So I have, platforms on TikTok and Instagram and YouTube, Facebook. And I go by Hospice Nurse Julie, where I educate about death and dying online.
How did that happen? Like, what was your aha moment for that mission?
Yeah, I feel like I really lucked out when it comes to like starting my social media journey. I have fell in love with hospice and being a hospice nurse. And over the years, and most recently, before I started my channel, 2 of my very good friends' parents were dying. So I was really working with them and like kind of rattling off all the things I would normally rattle off to any of my patients and their families. And they were the ones that were like, so like their reaction to me telling them the things that I knew was shocking to me. They were like, how have I known you for so many years and I didn't know that you knew these things? Or like, and how come everyone doesn't know this stuff? You need to talk about this. People need to hear about this. What would I do if like you weren't around? Or, I mean, other hospice nurses know this stuff too. It's not just me, right? But maybe not everyone educates the way I do. I don't know. But they were the ones being like, you need to talk about this. You need to talk about this. And I went home to see my nieces who are teenagers, and they were on TikTok. And I got on TikTok while I was there so we could make dances together and do different trends that they thought were fun. And that's where that idea came from. I was like, wait a minute. There's like people my age on here talking about like gardening and space. And I thought, I want to talk about death and dying. And it was that quick and that easy because I think maybe 4 videos in, I went viral and like had 10,000 followers overnight, then 100,000 followers in a month, then 1 million in a year. Then I got a book deal because of that, so it really just unfolded. So it's just as shocking to me as anyone else.
I was fascinated by how you came about becoming a hospice nurse from actually being in the ICU, especially with one particular patient that just you knew was dying. Everybody knew was dying, but nobody said it. Just recount that a little bit.
Yeah. I mean, when I first became a nurse, I had like a plan, right? I was going to work in the ICU for 2 years and then go back to school for anesthesia. I had all these like big hopes and dreams, and I thought I knew what I wanted. And then when I actually became an ICU nurse, it took a good 2 years to really because you have to learn so much, right? And once I got to around that 2-year mark, I just started seeing some patterns. Now, some people, the ICU is an amazing place and it saves lives and it's great. But there are times, which I started seeing, where there were people who, came in with a terminal diagnosis already, had an operation because of this terminal diagnosis, then had several complications along the way. And 6 months later, they're still laying here in this bed, hooked up to 3, 4 machines, keeping 3 or 4 organs alive, and medications to keep them alive, and all these complications because of those medications and machines. And not once did we talk about maybe they're at the end of their life. Maybe this is too much. Maybe prolonging life at all cost is causing more suffering than anything. And I spoke up one day about a patient that I had been caring for 6 months, 6 months. And I loved this patient and I loved their family, who was also there every day for 6 months. And I finally just said the elephant in the room. I said, it was very vague. I was not direct because I was scared. I said, like, can we have a family meeting to talk about next steps or something like that? Like very general. But it was like, I finally had a voice and I was so surprised how everyone was like, yes, 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 yes. And the whole team, including the patient's family. So it's like everyone wanted to say it, but no one did. And I just started seeing how much my voice mattered and how I really could advocate for people. And after that meeting that we had that day, which surprised me how quickly it happened, the family decided to turn off all machines and the patient died before the end of my shift. And it's a gift now, it's a gift now, but at the time, because it was the first time I did that, it was a little shocking and hard, leaving that shift being like, wow, because I spoke up, my patient died, is what it felt like. But as time went on, I started seeing how powerful and how meaningful and how much we needed that. We needed that. And yeah, that made me passionate about like, okay, everyone's going to die. That's a given. And if that's the case, where do I want to work in this field? Like where else do I want to work? And that's where hospice started coming into my brain. Like, I think there's a better way to do it. And I don't think it's in the ICU.
It reminds me of something that I heard you say, which is that we were made to live and made to die.
Yeah.
Like it's actually natural.
Biological. Yeah. We're built to live and we're built to die. Like all of us we all are going to die. And to me, if we know that, which we do, what should that look like? How do we want that to look? And I think everyone should explore that question, whether you're like dying immediately or not. But specifically, I really think we need to talk about it more on an onset of a diagnosis that we know will be life limiting. Like if we want to be really concrete about it, there are certain diseases that we know will end someone's life. This person will die from this disease, unless they get like hit by a car or something crazy, right? But it's not talked about. It's always about how can we preserve the life, which is important too. How can we preserve the life? Yes. What can we do to extend the life? But also let's prepare for the end of what they want their end of life journey to look like. And I just think people would have way more peace around dying if we started doing that.
You've talked about the language, the death word, as opposed to passing. And that's something that's irritated me for many years, watching how the culture shifts toward getting away from saying death and dying. And talk a little bit more about how important it is to use the death word.
When we use different language other than my husband died or they're dying or you're dying, I think when we don't use those words, we are creating this taboo thing. It's so taboo we can't even say it. Right? So that's how it exists in our culture now. My husband passed, or they're gone. I've heard someone say that, like in an emergency, call someone and say like dad's gone, and they're like, gone where? Because they're not even expecting someone to say that someone died, right? So using these like euphemisms, I get it. It's to like soften the blow because it is scary and it is hard. But it's creating even more of a problem, I think, where we need to start using words like death and dying, dead, because they sound harsh because we never say it. And I think if we start saying it a little more, start getting more, a little more comfortable with it, it won't feel as harsh. People always say, well, I don't say that because it sounds so harsh. And then we have to think about, well, why? Why does it sound harsh? It sounds harsh because no one ever says it. And I think if we got a little, just forced ourselves, right? It's going to be hard at first, even hard for me. And I'm the one lecturing about it. I'm the one on the soapbox saying we need to say it. It's still hard for me to do it. And I think we just need to change that. And by the first step is, okay, let's do it. Let's say it. Let's say you're dying. And I try my hardest to do that. And most of the time what I get when people, I see relief on their face, because finally here's someone who's willing to talk about this with me, because everyone's been tiptoeing around the fact that I'm dying. And I want to have real conversations about this. That is what I'm met with most of the time. I'd say 9.9 times out of 10. There's always that offshoot of someone being like, don't say that to me, but very rarely do I come across that.
I've had so many experiences with different either friends or parents, whatever, through this you call the journey, And
Yeah.
I want to talk about a lot of different things, but one of the items on my list is hospice. What is it and what is it not? Because people are so afraid of that word, when it comes down to
No.
that time. And it happened to a friend of mine who had bone cancer and it was getting worse. And they were doing all these interventions. I mean, she was a dear friend, very tough situation. Went into the hospital. She broke her femur because her bones were crumbling and they tried to save it, made her get up and walk. You got to walk with surgery. And her husband, which is such an amazing thing, before social media, he was sending out texts every night, like little updates to all the friends about what was going on and how horrible it was in the hospital and what was going on
Yeah.
with that. And then finally one day he said in his text, it's been decided that she's going to go into the hospice and everything has changed. It's a beautiful space. We're getting ready for her to go. I'm getting chills just talking about it because
Yeah.
that's when I realized the first time, and it's been 10, 15 years, that there's a better way. And once that they went over that threshold, everything changed for them, the family, for her. Anyway, and I thought you could maybe talk a little bit about what hospice is.
It's a long answer because it's a lot of things, right? So the one thing I'll say, which I think always sounds a little cheesy, but I truly mean it from the bottom of my heart, is that hospice is about living. People always think you go into hospice because you're dying, which is true. But what hospice is trying to do is to help you live out the rest of your life and have a good quality of life, or a good enough quality of life, a better quality of life than you've had recently. But so hospice is funded, at least in America, by Medicare. Okay. So even if you're not on Medicare and your insurance is paying for it, usually Medicare is probably reimbursing the insurance company. So it's a free program. And basically Medicare or hospice, because Medicare is our boss. So hospice, if you sign up for it, you get into hospice, you get all of these benefits over here. And I can talk about that in a second and what they are. But you do lose benefits, some benefits over here. So you'd lose, like, you can't get chemo anymore. You can't get radiation anymore. You're not supposed to get scans or blood work anymore. It's about quality of life. It's about, providing care for you in your home. So a lot of people think you go to a hospice, which some people do. So some states have places you can go where you go to a hospice and you have a nice room, and it's usually a beautiful place. But a lot of people will also take hospice in their home. So that means the doctor, the nurse, social worker, the home health aide, the chaplain, we all come to you and give you care in your home. Hospice provides things like equipment, so like hospital bed, oxygen if you need it, a bedside commode, shower chair, briefs, bed pads, gloves, medications, all types of stuff to keep you comfortable in your home. What we don't provide, which I think is a very big misunderstanding. If you're in your home with hospice, what we don't provide is 24-hour care. So you hear a lot, families will be like, hospice didn't do a thing. I saw my nurse 2 times a week. I had to do everything. And that is the harsh reality that Medicare, who is our boss for hospice, says we can't provide what they call custodial care, which is someone to be there 24 hours a day to like change or clean or give you medications. We can't provide that. There are things you can, this is where it's like, this question gets really long. This answer gets really long because there's always little things where it's like, but if you have uncontrolled symptoms, we can provide that. So there's always things, right? If someone is in their home and having uncontrolled symptoms, they can provide a nurse 24 hours a day at the home. But that happens very few and far between, right? What most people need is someone just to help them care for their loved one. They don't know what they're doing. You know what I mean? And this is their loved one. And so it's hard. But we don't provide that. And that's a big misconception. So hospice, in so many words, is about living, is about comfort, and is about trying to support the family who is caring for their loved one at home until they die. And the purpose of hospice is to live and die at home, to die what we would call a natural death. So you're dying from something, right? Some disease, but we're allowing the body to shut down naturally. And the body does shut down naturally. So the body knows how to die, and it knows it's dying, and it will help you do it. And hospice is there to basically manage symptoms of your disease, not symptoms of dying, because dying is not painful, right? It's the disease you're dying from that can cause symptoms and pain.
Can you talk a little bit more about that? Because I think that's like symptoms of dying versus symptoms of the disease. I think that's really interesting. I feel like that could be a misconception as well, or just something that people don't even think about, symptoms of dying,
Yeah. And yeah, so there's a fine line, right? And of course, everyone is different. So I'm speaking in general terms here. So generally speaking, our bodies, like I said earlier, are built to die and know how to do it. And the body, when you're getting closer to death, starts getting cues, right? Like, hey, I think we're getting to the end here for whatever reason, whether it's old age or a disease. I'm going to start shutting down now, right? So the main things you will see will be increased sleep. The body is doing that. The body is like increasing your sleep. A lot of times your calcium levels will actually go up, so you will be more tired. It'll decrease your need and want for food and water. So like your appetite and thirst will go away. Maybe not fully, but sometimes fully. Like people like have no appetite and do not feel thirsty. Like they don't want it. And the body is naturally doing that. So that's something that naturally happens in the dying process. And basically you do that. So you sleep a lot, you don't eat and drink. You sleep a lot, you don't eat and drink. And the body will slowly start shutting down. The main like symptoms or like traits I see that are very, very clear that like death is doing this for us or the body is doing this for us is the actively dying phase, which is that very, very last phase of life, which most people don't know what it looks like. So when they see it, they're terrified and they think their loved one's suffering and something's wrong. But that's not the case, which is why I show videos about it so people understand what they're seeing. But the body goes into like this actively dying phase where the body makes them unconscious. So they're unconscious. Again, they haven't been eating and drinking already. They'll start having changes in breathing because the body is like systematically shutting down. Changes in skin color, changes in temperature, and the body is basically doing all of this because it's helping the body shut down. It's shutting down because of a certain disease, right? So some diseases don't cause a lot of symptoms or a lot of pain. I've definitely seen many people not need any medications when dying. Not that I'm anti-medications. I mean, more the merrier to me if you want it, especially if like you have if we think for any smidgen of a second that you might have some kind of pain or something, right? But I've seen many people, usually older people. So usually people like in their 90s who are dying of like cardiac disease or something, and they're just very elderly, and that's basically why they're dying. They don't need anything. Their bodies just let them go. They don't need any medications. But people who have already had a lot of symptoms, depending on the disease, right? If you have tumors somewhere that have always been causing pain, you'll continue to probably have pain, and we'll need to treat that pain, even during that actively dying phase.
A friend of mine just yesterday asked me to be her medical directive person, and said to me, I've known her for 30 years. Look, I know I trust you to take care of me when the time comes if I need it, and you aren't going to just pull the plug without, without considering what I would want. That's a very tough situation, and I'm wondering, and it goes back to the sort of caregiver thing too, which is how do you, as a friend or caregiver or designated health person, navigate that when maybe the patient isn't able to communicate very well?
So I would just for your personal, just for what's going on with you right now, I would, because your friend is of sound mind right now, I would actually have a long conversation with her about specific things that could happen and what she would want. So you don't have to have a guess.
Great. Thank you.
You really, really, really should do that, because that is a lot of responsibility. And if someone's able to make their own choices right now, they need to run through scenarios. How long would you want to be on a breathing tube?
Okay.
If the doctors are saying to me, you are brain dead and you're going to be brain dead and you're going to be spoon fed and blah, blah, whatever, all the, would you want to live like that? Like, ask specifics. And people get wildly uncomfortable because they don't want to think about that stuff.
Yeah.
And how I would say, if someone is kind of pushing back, like, oh God, I don't know, like, just do what I just trust that you'll make the decision. I would say to them, not just your friend, anybody, word it like it's helping you, right? So I know you're totally fine right now. And like, God forbid, right? Hopefully I never have to do any of this stuff. But if I did, it would really help me if you could tell me what you'd want. It would really help me. And usually by saying it would really help me makes them want to help you. So they'll answer.
I appreciate that advice a lot, because I think I was a bit overwhelmed by it. And she's watched me deal with both my parents, fairly long deaths, and knows that I will do everything I can to do their wishes.
Yeah.
Whether it's to live or to die, either way, but I appreciate that advice and I will do that.
Is your Nothing to Fear workbook, would that be helpful in this situation?
Oh, definitely. So my Nothing to Fear workbook / journal, it's actually called a journal, but it's like a workbook. There's 4 different parts. And the last part is like the practical part.
Yeah.
Where you can, because some people don't know scenarios to ask, to think of. And that's part of it. The last part of it is about like the practical things you need to think about, questions you need to ask yourself. Would you want this? Would you want this? Does this sound like something you want? And you can be as detailed as you want. Now, the journal is not going to count as anything legal, right? But at least you can like have your thoughts and like get ideas. So when you do fill out something legal, it's like right there for you. But people don't know what they don't know. If you're not doing this every day, you don't know. If you're not in healthcare, you don't know what to ask. You're kind of like, just don't pull the plug, or very general, right? Or pull the plug if I am brain dead. But there's so many versions of like brain dead. What does that mean? Is there, so it's a lot to think about. And if you don't know, you don't know. So something like the journal and my book really would help you.
The first thing I'm going to do is send her your book. That's the first. I said, read this, then we'll talk.
Yeah, then we'll talk.
This gives me such a great way to manage it. I do appreciate that so much, because we're all in this part of our lives right now.
Yeah.
Our community is. So yeah. Yes. And caregivers too, because I know we wanted to talk a little bit about that whole thing of, not having support, or what do you do?
Oh my gosh, I know.
Gab, though, I mean, I watched you care for your parents, and especially your mom, who I watched you in such angst about what to do, with her feeding tube.
Yes. Oh my God. You
And then
remember?
it fell out. Do I put it back in? Like, I think that's an experience that I think a lot of women in our community have had or may have. And I'd love to hear from Julie. Maybe Gab, you could give a little bit more context about that situation.
Wait. Well, because I wanted to talk about, and maybe this is what you're talking about, and you can also give me more information if you need, when they can't tell you what they need, right? When they can't tell you what they want and need, it's too far. And now you're just the one having to make all the decisions.
Mom, I feel like you were looking for signs.
I was.
And it wasn't clear if she was capable of making signs, but you were kind of looking for signs. And
Well, what happened was she had several strokes. She was on a feeding tube. And there was a point where it was really not looking good for her quality of life, anything. And I remember just looking into her very, very bright blue eyes and saying, Mom, do you want to stop this? And she couldn't talk, but she looked right at me and I could just tell that she wasn't ready to stop. At that point. But then there was a time, I'm sorry, man, that was tough. I know. And you just do your best.
I remember it so well. I remember the impact on you.
Yeah, it was hard. And finally, so that time we went on for a while longer, but there was a time where it was just obvious. So I'm just telling you, it's so difficult to know what to do.
It is. It's really difficult to know. And it's gray. It's a gray area. I love living in the black and white. I love people being like, this is what you do always and forever, or not do, or, have us a very distinct guide. And it's just not like that. It's just not like that. It's gray. And like some situations call for X, Y, and Z, which I can get into what X, Y, and Z are, and some situations don't. And it really does depend on the person, so it's gray. There's a gray area. Generally speaking, it's like you start seeing, and tell me if this is true for you, you start seeing when like doing the things to keep them alive seems like it's causing more suffering than good. You have to like outweigh the risk versus the benefit, right? So like continuing tube feed on someone who is clearly not tolerating tube feed, right? Continuing to aspirate and get pneumonia, have antibiotics, who seems to be like having to go in and out of the ER a lot. And every time they do, they have a really hard time bouncing back, that's when you have to start, I think, weighing out the risk versus benefit.
Well, we saw some things that were proof that she wasn't getting better. I mean, she had a growth, a tumor that was growing, but what I want to say though, is that the staff, because you talked about this, how you're helping with the family, and they were indicating to me in sort of subtle ways, hey, this is happening. They don't want to tell you flat out because they know you might resist, but that was okay. I mean, I heard what they were saying, and it's a lot of what you've done. They were advocating for the patient, really, and you just are so afraid to let go. You're afraid to do the wrong thing, but that's a big part of what I think the healthcare workers do so well. The nurses, even if they're not hospice nurses, they're nurses, right?
And it's important for you too. I mean, as you already know, to be an advocate. Like I have an opinion of what people should do, right? But it's not my mom. I'm not looking in her eyes and going, "Are you okay with this?" Right? Like, so you have to be an advocate for not just you, anyone listening has to be an advocate for their loved one, but also find a healthcare worker that you trust and say, what do you think? What do you think? And hopefully if they're good and trustworthy, they'll tell you what they think, and you can take that with a grain of salt, or you can, start making moves. It doesn't, again, and it's not black and white. I have a very close friend who has an very elderly mom. She lost her husband years back. She's kind of just this steady decline down. She's in her 90s. And him and I are like best friends. He's one of the people that encouraged me to talk about all this stuff online. So he knows the deal. He knows what I talk about all the time, right? And he still takes her to the ER and gets her IV antibiotics and gets her IV hydration and, asks and doesn't really tell me because he kind of knows I'm like, not anti that, but kind of like, when's enough? But when we do talk about it, of course I see his point. He's like, Julie, I know what she is like. I know what she looks like when she is just dehydrated. And guess what? I take her to the ER and get her hydrated and she looks better. So it's like so hard for me to go, oh, just don't do that, and I get it. I get it.
Interesting.
And then eventually, like you already know, there comes a time when like you can see as the loved one, you can see like enough is enough. And then it is. And that's okay too.
Thanks. Oh, that's wonderful insight and appreciate it very much. So much to talk about here.
So much to talk about.
So much to talk about. And one of the things I have two other big questions. One is, what do you tell people who aren't able to be with their loved ones when they die for whatever reason? How does the dying person feel, if anything, about it? How much guilt does the person that's left behind feel about it? Have you run into those situations?
Yes, all the time, all the time. And again, it's never black and white, but generally speaking, I do, from my experience with being with dying people, and this is kind of me now just like saying my opinion, because of course I don't really know, but I do feel like people who die alone, I don't know if they're really alone. I don't even know if they're really consciously there. I think they might be with their loved ones who's in the car trying to drive to the hospital to see them. Again, this is just my opinion now because I have no idea, right? But generally speaking, I have not seen people like really suffering and scared because they were alone, and a lot of times, depending on people's personalities, it's one of the phenomena that can happen where people will wait until everyone is there because they want everyone in the room. That's the type of person they were. And then there's people who will wait until everyone leaves and almost make sure that no one's in the room with them before they die. So you just never know. And blaming yourself and having guilt, one, I understand it. Two, it doesn't need to be that way, right? And three, one of my amazing friends who's a therapist, I can never get her name right, which is awful. I just call her Megan, but Megan Reardon Jarvis, there we go. She says that fixating on something like that, the guilt or like obsessing over that last moment that you missed, is part of the grieving process. And it's almost easier to do that than to like feel the pain of your loved one being gone. And when she said that to me, I was like, oof, I feel that, right? It's almost easier to like overthink, because at least you're thinking instead of feeling,
Wow.
you know?
What a great insight.
Yeah, it's like you're trying to control the past and it's normal. It's normal. But I guess I would just encourage people to know that like, I believe that their loved one is okay, alone, not alone. And sometimes people even choose to be alone, especially if they were like really like my mother is alive, but I think when she is dying, if she dies, like what I'd say a natural death, I think she would be someone who might choose to be alone unconsciously, just sort of like wait till everyone goes because she doesn't want people to see her like that, So it depends on the person.
I could see how that scenario in particular would be so hard for someone because they're like by their side and then they leave, it's like, I have to leave. I need to go home. I need to shower or whatever. And it's like, it's in that moment. And then you would just feel so guilty.
I particularly believe when people when they have been there and then they had to leave, I particularly really believe then that like that person chose that time.
Wow.
I agree. And it's amazing that they have that much control over, but the moment that they die, I find that amazing and quite, I don't know. How does that happen? How do you control?
I know. Well, that's why it's one of the phenomena. Like chapter 6 of my book, The Deathbed Phenomena is the longest chapter because end of life has a lot of mystery. There's a lot of weird things that we see enough. We see it enough that as healthcare workers, we actually educate about it. I mean, I'm an ICU nurse, I'm like all about science and biology. And like, I didn't think this stuff, I never, but because I'm around it so often and it happens so often, it's like undeniable. You have to talk about it. You have to educate about it. Not because like I don't know what it means. I don't know why it happens, but it happens enough that I feel like people need to know because it can be scary or it can feel bad or weird and confusing.
Yeah.
So you need to know it's kind of normal.
When your loved ones die along your life journey, whether it's your friends or your parents or whatever, you miss them so much, and especially the ones that just went too early, and so you always have in your heart this desire to see them, and part of you is hoping you'll get to see them, when you die. And you've talked about how, and I saw that video, there's a woman who was talking to her family or friends while she was dying, and you said, well, I don't know if it's in their head or if they're actually there, I don't see them, but whatever. I thought that was pretty fascinating.
Oh, girl, me too. I mean, when I started as a hospice nurse, again, like I said, I came from the ICU. I didn't know anything. It's like a whole new world over there, right? And when I started reading this small pamphlet book by Barbara Carnes, anyone listening, she's amazing. She has these amazing pamphlets. And she was a nurse. And one of the things that she says in there is like 3 weeks before death, people will start seeing dead relatives, dead loved ones. And I remember being like, ugh, like annoyed at first, like, who is this nurse saying something like this in an educational pamphlet, you know? Uh, until until I saw it with my own eyes over and over and over and over and over again. And now that I educate about it with my families, amongst other things, but I do always mention it. And I'm telling you, 9 out of 10 families will say, oh, that's already happening. They've already been doing that. So I really hear about it now because I think before, when I wasn't directly educating about it, people wouldn't say it because they're embarrassed or they feel weird. But now that I educate about it, it's like, wow. I mean, I hear about it all the time. It's amazing.
Well, it's very comforting. Very
Comforting,
Yeah,
yes.
it is comforting.
So
I
comforting.
mean, you just miss them so much.
In that video you're talking about, wasn't that amazing? And she sent it to me and she said, I heard my mom talking to all these different people. So I went to her room and and she's gesturing. I can't believe you're all here. So good to see you. Like, and she just said, she goes, I just pressed play and recorded the whole thing. I'm like, thank you for letting me show this.
That's a gift. That's a gift, and it says a lot about how you've been able to touch people and communicate with them, that they're giving you these gifts.
I know. It's so amazing. I have had people that I've taken care of course, and they are of total sound mind and body, okay? They're not like almost dying. They are men and women who are walking and talking, fully alert and oriented. They're not like they don't have dementia, they're not seeing other things, they're not confused. And they have just been like, my dad is in the corner. He's telling me it's okay. I can't believe I'm seeing him. Like he says, I am not ready yet, but I'll be there soon. And him and my mom are going to come get me.
Ah,
You're like, what? And actually, I don't respond that way. I just am like, that's so amazing. I hear a lot of people say this, and then they're like, really, you do? Because they're kind of like freaked out. I'm like, yeah, it's something that happens around the end of life. It's called visioning. They're like, oh my God, I thought I was going crazy. I'm like, no.
so enjoying this conversation because there's so much in there that we never talk about, and that's the whole point of this,
Yeah.
is to talk about it.
Is to talk
Yeah.
about it.
Yeah, I find it so interesting. I'm getting teary-eyed thinking about
I'm
it.
so sorry you were traumatized. You don't even know when your own
No,
children.
no. I mean, I think it's so beautiful that people would have those experiences. And I find it so fascinating that this is such a known phenomenon in this space, in this world. And yet, because we probably are so afraid of talking about dying, or it's just not something that we really talk about or think about, it's like nobody else knows.
Yes.
It's like,
That's what my friends were saying when I was talking to them openly when their parents were dying. They were like, what? Why is not everyone talking about this? I'm like, in my world, they are, you know? And he was like, well,
Yeah.
not everyone else is. So you
Yeah.
need to do this. And
Which is
to
why
my,
we're so excited to
which
be
is what,
talking to you right now.
right. Which is why I think I went viral so quickly. And not just me, there are other hospice nurses that are doing the same thing, right? I think people, because I always say, like at dinner parties, when I say I'm a hospice nurse, they're not like, tell me more, you know, they're like, oh, usually. So I didn't talk about it, right? But I think when you're online, it like gives you a space between you and the person so you can kind of consume the information as you want or something. I don't know. But I was so surprised by how quickly my videos blew up because from my experience in life, people didn't want to talk to me about it. Right. So there's must be something about the separation, you know, that makes it easier. I don't know.
We talk a lot about wellness. I mean, that's what movement living is. It's being healthy and well. How does being healthy and well help you manage, this transition to dying?
That's
It,
such a good question. I don't think anyone's ever asked me that. And that's such a good question.
okay, good.
Great. Great job, ladies.
Thank you.
Because it makes a difference. I think it does make a difference. So
Okay.
wellness, specifically with mental health wellness. So I can get into the physical stuff too. Um, but mental health wellness makes a huge difference in your dying process from what I have seen. Of course, again, always outliers. So I'm generally speaking here, but people die how they lived. So if you are someone, again, generally speaking, because I don't want to victim blame people who are dying. But if you are someone who has not explored yourself, right? Not explored who you are, right? What do things mean to you? What do people, how do they mean? Like who are they to you? What does your life mean to you? What's important to you? Um, who do you love? How do you love? Like you need people with some form of awareness of like who they are and some form of emotional, maturity tend to die more peacefully, I think. From that's been my experience. People who are unwilling to kind of investigate those things, unwilling to feel uncomfortable, or really don't like feeling uncomfortable, avoid all negative feelings at all costs, which is many of us, you know, it's coming for you, right? Like I feel like you have to not avoid those things. Like I always say, my book is called Nothing to Fear. But I have a caveat in the book where I say it's not really nothing to fear. It's just normal to fear. Like, yes, I don't think there's anything to fear with death from my experience. But if you do fear it, that's very normal. And the fact that you're even willing to say, I'm afraid, are your leaps and bounds of most people because they don't even want to acknowledge that they're afraid. So to me, learning to kind of contemplate your own immortality is the greatest gift you can give yourself. And I literally do that every day. I honestly do. And then what it does for me is help me be clear on how I want to live that day. It's not about like you're dying, so quit your job and like jump out of planes and travel wherever. Of course, you can do those things. To me, it's about being present in the day that you're in and like appreciating like how your coffee smells, like the fact that you have an appetite and you like the taste of food, that the sun is shining on your face, that you have legs that you can move around and walk, that you can speak. So I think it's like, I think it's imperative that people do that now. People do that now. Not in a morbid way, in a beautiful way. Because guess what? It opens up life, at least for me. You know, I feel like I can like truly live in the day that I'm in because I'm more present.
Which is the best, the best reason to be looking at your death as part of your life is because it helps you
Yes.
better. And mental health is definitely one of our, is a movement pillar. It's part of community. But
Yes.
you were going to talk a little bit about the.
I love what you're saying. You're
Yeah,
right. About
good,
I could
good.
go on and
We're
on. I mean,
we're aligned.
community.
Well,
Yes, we need community.
well, good. I'm so happy. I mean, just talk a little more about the physical side of it too, because
Yes.
it's one of them. And I'd love to hear your thoughts about that.
I'm more of an expert in like how to die well, but just because I'm going through my own health journey, because I'm 42, going to be 43, right? So having hormone changes, I'm experiencing migraines and all different things, right? So I am on my own journey. And just seeing patients of mine who have, now this is kind of before you're on hospice, I think. Once you're on hospice, do whatever you want to do. That's what I think. Like, don't worry about your vitamins. Don't worry about what you're eating. Eat whatever the heck you want. Drink whatever the heck you want. Like, go for it. Pre hospice, I think multivitamins are good. Omega 3s are amazing. Things for brain health. Um, Walking is amazing. Like, continue to walk. I mean, it's the same old thing you hear every day, right? Continue to walk, strength training, especially for women, and community. I know that's not physical, but I almost think it can be physical. I think we grow up in this like individualistic society that like makes us fiercely independent, which is amazing, slash, we need people. End of story.
Yeah. It's our whole third pillar. It's like movement, food, and connection is our third pillar. We think it's just as important, and we totally agree.
Yes. I mean, I don't know if you guys know, but I'm sober and I'm in a 12-step recovery program, which is obviously not for everybody. Not everyone's an alcoholic, but or likes 12-step programs. But I'm so grateful that I have that community, and having that community has literally changed my life. And I always think to myself, everybody needs something like this. Everybody needs emotional support. Like, I know when I feel bad, all I want to do is retreat away. I want to go away. No one see me. No one see me feeling like this. I don't know how to show up like this. And really what I need is to connect with somebody, is to connect with another person, either share how I'm feeling or just be with them, listen to how they're doing. And it just goes against everything we've been taught, I think, that like um hide away. And I don't think we need that. I think we really need community. So to fight against that urge to hide away, I think is important. Um, and food is my own personal journey now too. Cause to be very honest, I've had a very bad diet because I'm like, I love all types of good food that probably is not good for me. But recently with this new like pain thing I've been doing and the headaches I've been having, I've been trying an anti-inflammatory diet, which again, I don't know anything about diets, right? But I just think health and wellness and your diet and movement and community. I mean, what you're talking about is like, yes, I see it because, the better you can move, the older you get, I think the easier life will be, right? So
We always say like the quality of your movement is going to determine the quality of your life, and that is true up until the end.
up until the end, yes, agreed. And my patients who have had like an active lifestyle, healthy lifestyle, although it's hard for them to be bedridden, which eventually they probably will be, it takes longer for them to kind of get there because they've had this long, healthier life.
They call it a health span these days. That's your health span as opposed to your
Ah,
longevity. It's the longer that you have before you fall off that cliff. And that's the whole point here, is staying strong all the way as far as you can. But again, just that physical and mental health at the end seems like it's important and good to have.
yes, definitely. And I would say like, and I can say this through my own journey of like, when you're in pain and you're not feeling well, it's tough to be like mindful, right? And to like pause and to try to breathe through it and do all the things that like people who practice mindfulness would tell you to do. But I will say, because I have practiced that, because I live that way when I'm not in pain, it is easier for me to do that and it does help. And it does help. So it's something to practice, before you're there, before you're experiencing those things.
I love what you said about contemplating your mortality in order to be more present in your day and enjoy the little things that are truly so significant.
A few years ago, I felt so much pain all the time, just in my muscles. And I just wanted a t-shirt that said, everything hurts all the time. And then I dealt with it in a few different ways. Some of it was nutrition. It's not as bad now, but I read about your experience I heard your post, and talk a little bit about what you've been through in the last couple of weeks.
Yeah, so the last couple of weeks I've had a basically like episodical, like a cyclical period of like constant migraines. And maybe you could call it migraines, maybe you could call it chronic pain, because it kind of starts in my neck and then goes to my jaw and then kind of creates this like overall, best way I could describe it is like overall, just like I feel like a raw nerve, like everything is just on fire or something. And that's not abnormal for me. I've had migraines since I've been a little girl. So like but they have gotten worse as I've gotten older. And these periods of time where I'm like basically not functional for 2 weeks, is what really can cause that panic. You think you're in it. It's so hard to think your way out of it, or say like this won't always last, right? Because it keeps lasting. And because for my experience, like there was no obvious reason, meaning like I've had scans done and, things that they couldn't see why I was in pain. I was met with a lot of resistance from doctors to help me, like, well, we can try this medicine, we can try that medicine. And it was like, well, I've tried those medicines and they're not working. Like, please. And it was sort of like I was met with well, that's how migraines work, and I just was like, wait, no, 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 no. Someone needs to. I mean, honestly, I was to the point where I was basically begging, like, I'm like, can you just please give me medicine to knock me out then? Like, can you give me some benzos? I mean, that's not even going to treat the pain, right? But like, I need to sleep. I need to like not feel so raw. Um, and I was just met with such a lack of compassion and suspicion, really, because of like, I was so desperate. And I've never been on that side of healthcare. I've heard people talk about it. I've heard people say stuff like that. And it was such a scary feeling for me, because it was like, wow, what am I really supposed to do if no one will help me? Now I've come out of it, right? For whatever reason. I don't know why I have. And it just made me, like you said, want to take some things more serious, because mainstream healthcare, at least for the pain that I'm experiencing, is not helping me. So what do I do? Do I go to diet? Like I was saying, the anti-inflammatory diet. I joined a migraine group of women to say like, what have you been doing? I'm going to go to a hormonal doctor.
Sure. Yeah,
Uh,
all the right things.
yeah, all the things, right? And now that I'm feeling better, I can do that. It was a little tough when I wasn't feeling good, right, to do that. But
Yeah.
and I do think when it comes to hospice though, right? When it comes to like people having pain because of cancer pain or because of tumor pain, tumor burden, things like that. Especially in hospice, thank God, you are not met with that. You are not met with resistance. I think hospice is the only place where people are like, here you go, whatever you need, whatever you want. Like, we are pain control experts. We will control your pain, usually through medication. Um,
Fine. Fine
yeah.
with me.
And it's like, yeah, let's do it. And people always talk about, oh, I'm afraid of getting addicted. And yes, there is fear of dependency, right? But if you're not going to be here in, 6 months, a year, that's what it's like. And you're not going to get high from this medicine. You need it. When you take pain medicine, when you need it, you don't experience a high. You experience relief.
I learned a lot about that when I had a big knee surgery, and it was just the most painful thing in my whole life. And they said, don't be a martyr, get the pain relief before it gets out of hand. I've always remembered that.
Yeah.
Don't be afraid to take it when you need it before it escalates, and then you can't get it under control. Pain is a whole
Right.
nother subject, and there's a
Yeah.
lot
I
of
mean, I
science
could go on
around
and on.
the
Yeah.
neurology. It's quite an interesting subject.
You mentioned that you pray and meditate in the morning. I'd love to hear about that practice, and is that an important part of grounding you for the work that you do, which I'm sure is very emotionally taxing?
Yeah, I mean, I do it for work, and I do it just for my life, and part of my life is my work. So, for me, it's just important. that, I have a higher power. That's a very general higher power. I call it God because it's just easier to say, but it's not like a specific God, I suppose. And it's important for me mentally to like connect with that higher power on a daily basis so I can, I don't know. So I don't operate on my own accord all the time and like think and like get in this because I can really, I am just like anybody else. I am super anxious. I can totally try to control things, obsessive. And I just know that when I pray and when I meditate in the mornings, that helps me not be so much like that. I have more of a pause in my day. I think of others in my day instead of just thinking about all the things I need to do. So I don't always pray or I don't always meditate. Sometimes I meditate for a long time. I do a whole like guided meditation for 20 minutes. Sometimes it's just about me breathing. Breathing. This is what I do. I breathe in God and I breathe out Julie. Breathe in God, breathe out Julie. I was taught that from one of my friends, and I have a couple of different prayers I say. Ones, I can say them. I say, walk with me, talk through me, sit by me, help me have eyes and ears open for opportunities of service. Your day, not mine. And then the other one I say is, please help me set aside anything I think about. And if I'm like obsessing over something, I'll say the thing. Or if it's like, please help me set aside everything I think I know about today, about the traffic, about my work, about so-and-so, for an open mind and new experience. Please let me see the truth. And it's kind of quick. It's like that. It's like that. And then I sit there and quiet for a little bit. And sometimes if I'm like really having a hard time, I'll spend more time in meditation. But it's usually pretty quick.
What a practice. And it is practice, isn't it?
Yeah. Yeah. It's practice. Yeah.
You are a light. You are a light in this world, Julie.
Oh, thank you.
You are.
Thank you.
We have the Movement Living 5. They're like rapid fire questions. I'd love to go through them quickly with you and then we can wrap up if that works for you.
Yeah, that's great.
In a few words, what does wellness mean to you?
I think living presently and being able to feel and experience all things, including uncomfortable things.
What's a daily habit that you swear by to feel your best?
Prayer and meditation.
Do you have a health concern that you think about the most?
Girl, you know it. No, I'm just kidding. I don't really think about it the most, but because it doesn't. But my, I would say my neck pain, which we could call migraines. I think about that the most.
And what's your favorite way to treat yourself?
Probably a Diet Coke from McDonald's specifically. Specifically, Diet Coke McDonald's with lots of
Why
ice.
McDonald's specifically? I need to know.
Oh, because they have a specific type of like syrup. Like they have like some kind of Diet Coke syrup that's like better than everybody else's. It's like, and I supposedly that's like a known thing. They really do have like a special syrup, or maybe the carbonation's different. It's very specific, and it's not in every state. So not every state has good Diet Coke McDonald's.
Okay,
Just
this is
FYI.
great to know. We're in Canada. I'm going to
Those who
investigate.
know. The people who know. But I don't know if that's really, it's kind of like a bad way to treat myself because it's like not good for you, but
No, it's
it does
fine.
feel like a treat.
Yeah.
The question is open for all treats, good and bad.
Okay, good.
And then the last one is, what's something that you are learning right now?
Yeah, something I'm learning right now. Yeah, I think because the pain thing is so present, I'm learning to continue to try to advocate for myself, continue to try to support myself the best way I can. Like you guys were saying, like with movement, with food and health and wellness and vitamins and like to seek out answers about why I'm having so much pain. What I do is like when I'm in it, I do all the things and then all of a sudden I get out of it and then I stop all the things. Because I'm just like, oh, well, it's gone. And I really have been trying to be like, okay, this time, Julie, you cannot do that. You have to keep seeking. You have to keep trying to figure this thing out so it doesn't turn into this like cyclical thing. So that's something I'm learning to try to do.
That's interesting because we talk about building a wellness habit, which is exactly it's like your morning habit. And practice. It's a wellness practice. So I encourage that. That's great. I hope that works for you, that you continue with that, building that habit. Yeah.
Me too. Yes. Thank you.
Well, thank you so much, Julie. Is there anything else that you really wanted to share with our community about you, or where can we find your book, the journal?
You guys did a great job. So I have nothing else to share. You guys asked amazing questions, and I love, love, love what you guys are doing. Thank you so much for doing that. And yeah, you can always go to my website, hospicenursejulie.com. You can find the book there and then the journal there. I love my YouTube channel. I'm on all the social media as Hospice Nurse Julie, so you can find me wherever you get your social media. But my YouTube channel is my favorite. I spend more time there. I go live every week there. So if you ever wanted to talk to me live and ask a question, Hospice Nurse Julie across the board. And then you can find my books basically anywhere you get books. But if you want an actual link, just go to hospicenursejulie.com.
Thank you so much. I know we are going to be ordering that book. I think Gab's going to be gifting the book.
I copied. I can think right now of who to send it to. It's
that's amazing. Yes.
Yeah. Thank you.
Thank you so much, Julie. It's been such a pleasure. And yeah, we just love the work that you're doing and really grateful for you, and wish you the best of luck on this new wellness journey as well.
Yes. Thank you.